Hey everybody, welcome back to the show. We've got an important topic for you here today, and that is the rise of lung cancer in non-smokers and why that is important for you. So this is an important topic, I would say, for myself, my family, is to be on the lookout for early detection, and then of course what you can do about it. And I want to share the same information with you. Again, if it's important for me, my loved ones, that means I need to share it with you as well. So let's go through all of the risks, why 2 out of 10 cases, up to 2 out of 10 cases in lung cancer are from non-smokers. So hopefully just right off the bat, you know that if you smoke and you inhale any type of smoke in your lungs, so it doesn't matter if it's from cannabis or it's from cigarettes or anything like that, it matters if you're inhaling smoke. So I'm not saying that there aren't other carcinogens in cigarettes. There are, no doubt about that, and I agree with it. But inhaling smoke, in and of itself, is what I'm trying to share, is a carcinogen. Carcinogen means cancer-causing thing, activity, product, etc., right? So breathing in smoke, first and foremost, is going to be that number one cause. Okay. Hopefully we all know that by now. So what are the other causes? Let's actually go through that. So the first one that you may not know about, and is kind of random, is radon exposure. And so when's the last time you tested your home for radon? Again, probably at home inspection, maybe, right? And so what do we want to do? Well, we want to actually be, because just for peace of mind, to be able to use some type of device or be able to test the house for radon, because it's the number one cause. So what I want to do, and I want to try to update this on at least an annual basis, I'm going to link up the best sensors for radon. So you can just go to stevencabral.com/3198. I'll link some up for you. Again, I have no bias with any of these. Whatever is the best, the easiest, and hopefully the least expensive is what we'll link up. Because radon is not something that you're going to smell. It's basically an odorless gas that can be coming up from ground level, that, especially the basement, that you or your children or pets might be being exposed to. And it's present in essentially most soil and rock and groundwater. So more important in those specific areas as well. But it quickly becomes radioactive in the body. So like that radon, the radioactive particles they get breathe through your nose, through your mouth, into your lungs, and it can obviously, unfortunately, cause cancer. And right now, it's said that 1 in 15 homes are being exposed to radon. So really important. I'm also going to link up geographical areas at stevencabral.com/3198 to see if you're in an area where you should be a little bit more concerned. It doesn't mean that you should be worried. So there's a big difference. You want to have this knowledge. You want to know about it, but you don't have to worry about it. So you say, okay, I'm in a zone that's going to potentially be more exposed to radon. No problem. Here's what I'm going to do. I'm going to get a radon sensor and I'm going to check, or have someone come out once a year and say, okay, do I have radon? Yes or no? The answer is no. Good. Peace of mind. It's kind of like when I do my blood work or my MRI or whatever it might be. Okay, good. Peace of mind. On my way, right? So like that's really what it's all about. All right. The second one is this. This is important. Secondhand smoke. People may have heard this before, but it's extremely important. So if you are someone that is exposed to someone at work, in the car, at home, smoking, or at a job or a place like that where there is smoke that's being inhaled, this increases your risks for lung cancer as well. So it's what I've seen as well as adults that don't smoke, but they're around others that do smoke, increases their risk for lung cancer by 20 to 30%. So it's not just the individual. Again, some individuals, just great genetics, they never get lung cancer, even though they smoke a pack a day. Well, you could be that person without the great genetics. You're exposed to that secondhand smoke, and unfortunately, you get the lung cancer. Now, we also know that, of course, secondhand smoke, as well as smoking itself, leads to heart disease, stroke, potentially infertility, a lot of other issues as well. So really important. And then your apartment buildings as well, if there's smoke kind of coming through, which it can be, you want to be aware of that as well. All right, the third leading cause, or another third factor we'll talk about, is chemical exposure at work or in your building or wherever it might be. So, okay, it's not as much of a case anymore, but older buildings certainly had asbestos, which can lead to mesothelioma, which can then cause essentially cancer in the lining of the lungs. So it's not just that though. Other chemicals such as arsenic or silica breathed in, or nickel, or any of these metals that can be consumed into the lungs could cause cancer as well. Even coal fumes or plastic burning, VOC, like anything that is chemicals that you're breathing in. Remember, so let's just think about it this way. Let me grab my model here, Walter. All right, so if you're watching this on video, you are breathing in air through your nose or through your mouth, and it's coming down. You can see your lungs, right? And what has to happen is that it has to be consumed through the lungs and then moved through. So everything is moving through those lungs, which is why, like, if you consume a lot of alcohol, could end up with stomach cancer. Well, the alcohol sits in the stomach before it moves through the digestive system, the liver, etc. All right, breathing in smoke hits the lungs first. The lungs is trying to filter, and then it moves into the bloodstream. So really important that we look at this. And people that might be need to be most aware are people working at gas stations or mechanics or hair salons, nail salons. Who else might be a part of this? Dry cleaners, truck drivers, anybody who's exposed to more chemicals in the air. And I'll say this, air pollution alone is linked to an increase in lung cancer. Cancer in general, but lung cancer. So it's pretty crazy. When I lived in downtown Boston, so like I lived in downtown Boston almost my whole life. So I lived there about 20 years. And I'm walking by every day, and I love Boston. I love downtown Boston. I lived in Back Bay for a while, and I lived in the South End, not South Boston, but the South End for about 15 years, maybe 16 years. And so here's the thing, though. We've got trains, we've got subway, we've got the cars, we've got all the combustion that you are breathing in. So we have to understand is that, and then again, all the new homes and everything being built, all of those chemicals are in the air. So it's important to be aware when you're in a city that there are, potential issues considering that. All right, just a couple of others. I love these stats, and I wanted to share this. This is directly from, I think this is from Pronovo. So Pronovo, I have no affiliation with them. I don't get any commissions or anything like that, but they are really the premier full body MRI company that can pick up things like cancer in the lungs or cancer in other organs, parts of the body. Now, CT scans, again, CT scans are still fantastic. So I'm not saying that you can't do a CT scan, but for one without a low radiation, et cetera. So here's a couple of stats, though, that I think is really important. That for men, it's estimated that 1 in 16 men will be diagnosed with lung cancer, which is crazy. 1 in 16 men. Think about it. You see 16 guys in one room, one is going to be diagnosed with lung cancer alone. Unfortunately, 8 of those men are going to be diagnosed with cancer in their lifetime. And for the women, it's 1 in 17. So it's pretty much the same. Every 2 minutes in the US, someone is diagnosed with lung cancer. And unfortunately, it kills about 357 Americans today. This is why it's an important topic to talk about. All right, there's some good stats coming up in just a second, though. All right, so lung cancer screening is recommended for everybody. If you've been a smoker for 1 pack a day for about 20 years, or you currently smoke or have only quit within the last 15 years, and then anyone ages 50 to 80, right? So you can do before that, you can do definitely during that. I'm a huge advocate of a full body MRI if you're able to. And I don't know if we got a discount code. If we have a discount code, I'll certainly pass it along. Just go to stephencabral.com/3198. Why don't I'll try to get you a discount code if there is one. But let's give you away from the negatives. Let's give you some positives here. So 20 minutes after you stop smoking, just literally a cigarette, your heart rate and blood pressure will begin to stabilize again. But every time you smoke, they become destabilized. Your blood literally thickens. So a few days after quitting, your body's carbon monoxide levels drops back down to normal. It's great. It's good for your brain too. Several weeks after quitting, your circulation will have increased. 1 to 12 months after quitting, coughing and shortness of breath decrease and mucus clears up from the lungs, greatly reducing your risk of infection. Why? You're emptying your rain barrel, right? Big thing, especially if you do sauna. Sauna is one of the best ways to help people quit. 5 to 10 years after quitting, your risk of mouth, throat, and voice box cancer is reduced by half. 50%. And 10 years after giving up cigarettes or secondhand smoke or a lot of these chemicals, right? Your lung cancer rate will be nearly half of the risk of a person who is still smoking after 10 to 15 years of smoking. You are also at a reduced risk for bladder, esophagus, and kidney-based cancer. So really important stats. Why I brought this here to you today is that there's more to look at than just smoking alone. I'm going to link up the best radon detectors I can find, or maybe some radon companies. We have to be aware of the secondhand smoke, no doubt about it. So we talked about that. Air pollution, chemicals, use an air filter in your home. Even if you can only get one, use it in your bedroom an hour or two before you go to bed. Keep it in your bedroom overnight, then move it into your main living area during the day. Easiest way to do it. All of my favorite resources, by the way, are at stephencabral.com/resources. Pretty easy, right? That's where they all are. Those are my favorite places. And then, if possible, try to do a functional medicine detox every 12 weeks. Super simple. The one that we use in our practice is stephencabral.com/detox. You need to keep emptying that rain barrel. Sauna is great. All these things are great, but give your body the raw material it needs to really do a deep detox every 12 weeks. So that's what I want to share with you here today. Again, all those resources, except any nutritional supplements or detoxes, will be at stephencabral.com/3198. Take care, buddy. Do share the show with anyone you believe it could serve. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.